Hi, my name is Bertrand Dirk, and today we'll be discussing about cervicogenic headache. Now, cervicogenic headache, according to the International Classification of Headache Disorders, is classified as a secondary headache disorder. Secondary headache disorders refers to headaches originating from a problem other than the head itself. So this basically means the headache pain occurs due to another condition stimulating the pain-sensitive nerves of the head. In the case of cervicogenic headache, this condition refers to a dysfunction along the cervical joints of the neck. This could be a dysfunction in the muscles, joints, discs, ligaments, or even nerves of the neck. Any of these aforementioned structures can then lead to cervical afferent nerve fibers to be stimulated to create pain pathways into the head, known as cervicogenic headache. Now, what are the symptoms? So basically, those suffering from cervicogenic headache may have mild to moderate pain. The headache is usually experienced on one side of the head and often commences at the neck and causes its way up to the head and over to the face region. Sufferers may feel pulsating or sharp pain along the eye, the forehead, side, or the back of the head. They will often have focal discomfort along the neck as well as reduced range of motion in the neck. Nausea and vomiting may also be present with those suffering from cervicogenic headaches. Patients may also experience dizziness, tinnitus, difficulty concentrating, inability to function normally, and may also experience depression. And keep in mind, cervicogenic headache is usually located on one side of the head, being a unilateral disorder. So, what then is the cause of cervicogenic headache? Now, an injury or dysfunction to the neck is thought to be the main cause of pain referring to the head. This could be a sudden neck injury, such as a motor vehicle accident, a fall, a blow or strike to the head, or any other forms of whiplash injuries to the neck. However, many sufferers do not recall of any neck injuries whatsoever, and most of the time have no history of any acute trauma to the neck or the head. In this case, the injury to the neck most commonly occurs due to a repetitive strain injury. Now, this occurs in those who have a poor posture, with the heads protracted forwards. Due to the poor alignment of the neck and the head, this can place tremendous strain and forces to the neck joints, muscles, ligaments, and nerves. This commonly is found in office-type workers who are sitting in a poor posture, or even people using their phone, book, or computer with the head leaning forwards in that poor posture. Other examples are labourers, such as builders or painters, who may constantly look up or down with the head and over time incidentally strain their neck during their repetitive workload. These can all cause repetitive strain injury to the neck and over time develop cervicogenic headache. Now, in the case of cervicogenic headache, the injury or any dysfunction to the neck will stimulate afferent nerve fibers. Now, this will send signals to the head, which is perceived as pain, known as cervicogenic headache. Now, those with cervicogenic headache exhibits with a dysfunction in the upper three cervical spine, and these are the atlanto-occipital joint, which is basically the base of the skull and C1, the atlanto-axial joint, which is the first and second vertebrae of the neck, and C2, C3, which is the second and third vertebrae of the neck. Now, clinical trials indicate the problem from the upper cervical spine to result in a sensitized brainstem. And those suffering from cervicogenic headache will have a dysfunction anywhere along the OC1, C1, C2, or C2, C3, or a combination of all these three segments in the neck. Now, the brainstem, and more importantly, the trigeminal cervical nucleus, is located in the upper three cervical spine. Hence, a dysfunction in any of these joints will result in a sensitized brainstem, which will then induce pain to radiate into the head. Those with this problem will perceive headache and potentially migraine pain as a consequence. Hence, if you believe that you do suffer from cervicogenic headache, then there is safe treatment options available. And treatment can usually restore or stop these cervicogenic headaches quite dramatically and fast. Hence, if you do have these symptoms, then make sure you seek professional help. Those who are headache clinicians who deals with chronic headaches or migraines, and more importantly, cervicogenic headache. For further information, feel free to contact us on 1-800-HEADACHE or email us. My name is Bertrand. I hope you've enjoyed today's presentation on cervicogenic headaches, and I look forward to seeing you in another video. Thank you.